Breast cancer is the most common cancer in women worldwide. According to the World Health Organization, about 1 in 8 women will get breast cancer in their lifetime. It is the leading cause of cancer death in women globally, accounting for 15% of all cancer deaths among women. But what exactly is breast cancer? What are its early warning signs and symptoms? How is it diagnosed and treated? And what should you do if you have concerns about your breast health? This episode of The Doctor Is In will answer all these questions, so make sure to watch the video till the end. Before we start, please like and subscribe to the channel to get the latest updates on our videos. Breast cancer occurs when cells in the breast tissue start to grow out of control, and they multiply rapidly. Normally, cells in the body grow and multiply in an orderly fashion, and they die when they become old or are damaged. But in cancer, the cells do not die. Instead, they continue to grow and divide, which can form a mass or tumor. Breast cancer usually starts in the milk ducts or lobules, which are the glands that produce milk. However, there are other types of breast cancer that start in different tissues of the breast, such as the connective tissue or the blood vessels. There are many different types of breast cancer. One of the most common types is called invasive ductal carcinoma. As the name suggests, this type of breast cancer starts in the milk ducts and then spreads to the surrounding breast tissue. Another common type of breast cancer is invasive lobular carcinoma. This type starts in the milk lobules and then spreads to the nearby breast tissue. So how do you know if you have breast cancer? The most common symptom of breast cancer is a lump or mass in the breast. However, it is important to note that most breast lumps are not cancerous. They could be caused by a number of other things, such as fibrocystic breasts, which are breasts that have many small cysts or fluid-filled sacs. These can make the breasts feel lumpy or sore. Another cause could be fibroadenomas, which are benign or non-cancerous tumors that most often occur in women in their 20s and 30s. They usually feel like a small, well-defined lump, and they may move around a little when you move your breast tissue. Also, breast cancer can cause changes in the size or shape of the breast. If one breast becomes noticeably larger or smaller than the other, it could be a sign of cancer. The cancer can also cause the skin around the breast to change. The skin may become red, scaly, or thickened, which could be a sign of inflammatory breast cancer. This is a rare type of breast cancer that causes inflammation of the breast tissue. Other less common symptoms of breast cancer include nipple discharge, especially if it's bloody or has a yellow-green color, thickened or swollen areas around the collarbone or armpit, and enlarged lymph nodes in the armpit or around the collarbone. The good news is that early detection and treatment of breast cancer greatly improves the chances of survival. To diagnose breast cancer, a doctor will first ask about your symptoms and medical history and perform a physical exam. They will feel for any lumps or masses in the breast and check the lymph nodes in the armpit and around the collarbone. In addition to the clinical breast exam, there are 3 other screening tests that are used to detect breast cancer. These are mammography, breast ultrasound, and breast MRI. Mammography is an X-ray of the breast that can detect small tumors that cannot be felt by a doctor during a clinical breast exam. Breast ultrasound uses sound waves to create images of the breast. It can help to distinguish between a solid tumor and a cyst, which is a fluid-filled sac. A breast MRI uses a magnetic field and radio waves to create detailed images of the breast. It is more sensitive than mammography and ultrasound in detecting small tumors. If a tumor is found, a biopsy will be performed to remove a small sample of the tumor for examination under a microscope. The biopsy can be done using a needle, a small instrument, or a surgical procedure. The pathologist examines the biopsy sample to determine whether the tumor is cancerous and what type of cancer it is. They also determine the grade of the tumor, which is a measure of how abnormal the cancer cells look under the microscope. The higher the grade, the more aggressive the cancer is likely to be. If you are diagnosed with breast cancer, there are several treatment options available. The most common treatments are surgery, radiation therapy, chemotherapy, hormone therapy, and targeted therapy. Surgery is the most common treatment for breast cancer. Now, the type of surgery will depend on the stage of the cancer. For early-stage cancers, the most common surgery is called a lumpectomy. During a lumpectomy, only the tumor and some of the surrounding tissue are removed. For more advanced cancers, a mastectomy may be necessary. In this procedure, the entire breast is removed. After surgery, you may receive radiation therapy to kill any remaining cancer cells. Chemotherapy is the use of drugs to kill cancer cells. It may be recommended before surgery to shrink the tumor or after surgery to kill any remaining cancer cells that may have spread to other parts of the body. Hormone therapy is a type of treatment that blocks the hormones that fuel the growth of hormone receptor-positive breast cancer cells. This can be done with medications that lower estrogen levels or block estrogen from binding to its receptor. Targeted therapy is another type of treatment that uses drugs to target specific molecules involved in the growth and development of cancer cells. If you have any concerns about your breast health, please talk to your healthcare provider. Early detection and treatment of breast cancer can greatly improve the chances of survival. Thank you for watching today's episode. If you liked the video, please hit the like button, subscribe to the channel, and share this video with your friends and family. Don't forget to follow us on social media. We wish you a healthy and happy life ahead.